Nurses see wounds in many different settings. An abrasion is a superficial wound with little bleeding and is considered partial thickness wound. A laceration sometimes bleeds more profusely depending on the depth and location. Puncture wounds bleed a lot in relation to the depth and size of the wound. When a patient's condition is stabilized, nurses should assess the wound to determine how it's progressing towards healing. The nurse should observe whether the wound edges are closed. A surgical incision is healed by primary intention and should have clean, well-approximated wound edges. The nurse should note the amount, color, odor, and consistency of drainage. Drainage types include serous or clear, serous sanguineous or clear bloody, sanguineous, which is bloody, or purulent, which is pussy drainage. The healthcare provider usually inserts a drain near a wound that has excessive amounts of secretions. Surgical wounds are closed with staples or wound closures. When inspecting a wound, the nurse observes for swelling, separation of the wound edges. While wearing gloves, the nurse can press gently on the wound edges to detect localized areas of tenderness or drainage or fluid collection under the suture line. If this pressure causes fluid to be expressed, the nurse should note the character of the drainage, and if it's suspected of infection, the nurse can obtain a specimen and send it for culture.